The next speaker for the day is Dr. Sameera Shaikh. Dr. Sameera Shaikh is a prosthodontist. She did her BDS from YMT Navi Mumbai and MDS from GDC Nagpur. She did her master's in implants from New York University and a fellowship in full mouth rehabilitation from Okayama University, Japan. And she has 15 years of clinical experience practicing focused on prosthodontics and implants. Today, she's going to talk to us about how to don and doff the PPE. Over to you, Dr. Sameera Shaikh.
Thank you, Santosh sir, for the kind introduction. I'll start sharing the screen. Yeah, is it visible?
Yes, visible and audible both.
Okay. Good afternoon, everyone. First of all, before I start with my presentation, I would like to thank Dr. Anil Arora sir, Kumar Swamy sir, and the entire E-Famdent team to give me this platform to share my views on personal protective equipments. And my topic for today is how to don and doff PPE. So the COVID-19 pandemic has greatly impacted dental practice. It is well documented that the dental professions are at very high risk of acquiring this infection. With increasing number of cases each day, there is no hope of revival anytime soon. So we should adopt to new precautionary measures and accept this as a new normal. As you can see in this photographs, the drastic difference between pre-COVID times and the COVID era. Now we have to be completely covered 360-degree from top to bottom, and even patients cannot recognize who's the dentist and who's the assistant. So the CDC has recognized three common route of transmission of coronavirus, which is firstly the contact through direct contact through person to person or indirect contact by touching the contaminated surfaces. Then comes the respiratory droplet and the airborne droplet nuclei. So the basic principle uh, for protection from this coronavirus is to consider every patient coming to your clinic as a COVID positive patient and carrying out protective measures. One of the protective measures is to completely wear the personal protective equipments, PPE. The OSHA defines PPE as specialized clothing or equipment worn by an employee for protection against infectious material. Now, PPE is like commonly considered as just a protective clothing, but it also includes goggles, face shield, medical cap, the surgical mask, or the N95 respirators, the shoe cover and the leg cover, the disposable gloves, and even alcohol-based sanitizers are considered as PPE. All the protective equipments that are intended to be used as medical devices, they should be followed according to the FDA regulations. Now, first I will talk about protective clothing. So protective clothing normally includes gowns and coveralls, and this clothing, it should be resistant to fluid and it should not allow virus penetration. So the commonly used fabric to make this protective clothing is non-woven polyester or spunbond. This clothing can be laminated with polyethylene or polyurethane coating that makes it impervious. Now the GSM is the thickness of the material, and around 60 to 90 GSM is good enough for dental procedures. Now, while selecting this PPEs, we should first check whether they have these valid approvals. Like the FDA approval is the most important one. FDA is the principal agency for approval. Then it should also have ISO standardization, the CE certification, which meets the European standards. The CITRA certification is for the local Indian market, and it is used to certify the disposables, basically the non-woven fabric. Now, the regulating bodies, they carry out certain standard tests to evaluate the ability of the fabric as well as the seams of the PPE to check if they are resistant to synthetic blood penetration and viral penetration. The protective clothing can be classified like we have different varieties. These are the main three varieties. Firstly, it's the isolation gown, which is made by non-woven spun bond. And this isolation gowns, they come in the thickness of 30 to 60 GSM, but they are not very durable. Hence, they are used as disposables, or it can be used for 1 to 3 times. They are basically used for low risk procedures like just checkups or some suture removals or some minor procedures. Then we have coveralls. Now these coveralls, they are made of non-woven polyester. They can be disposable or washable. So they have good thickness of 70 to 120 GSM, which gives them more durability. So this coveralls should be used for most of the aerosol generating procedures. Then we have surgical gowns which are made of high grade cotton. This cotton, this gowns, the outer layer, it is also chemically treated and roll pressed to make it impervious to the fluids. Now, these gowns, they can be used only for one patient, and after every surgery, it should be autoclaved. They are highly durable. Now, the advantage of disposable clothing, it is that there are minimum chances of contamination while handling this gowns and coveralls during sterilization procedure. But as compared to the reusable ones. But why there is need of reusable protective clothing? Why we should opt for reusable ones? Because as the cases are increasing, there is a surge in bio waste, and the biomedical waste agencies, they incinerate this bio waste. So imagine the amount of air pollution that is being created. Also, the disposable PPEs, they increases your clinic expenditure. So a better option is to opt for washable PPEs, which are safe enough and also eco-friendly. So this is the washable coverall gown that I am wearing, and it is from Mafatlal, which has all gold standard approvals. It also has ISO certification and the GMP certification, the CE certification. This gown is made up of polyester, which is available in 60 to 90 GSM. It is polyurethane coated, hence it is highly durable. It has good tear strength, and it is very repellent to fluid and blood and water. It is also easily washable. So I prefer, nowadays I have switched on to this washable coveralls because they offer huge saving of money and also reduces the bio waste. So how will you wash this coveralls? You just have to soak it in soap and detergent water for 1 hour. After drying, you can spray it with hypochlorous acid disinfectant and use it. It should not be bleached with sodium hypochlorite as it may cause stains to the garment. Now, is washing enough to disinfect this coverall? So the answer is yes, because coronavirus, it has the outer lipid membrane, which can be easily killed by the lipolysis action of soap and water. This coverall should not be autoclaved as it may damage the outer polyurethane layer. Next comes the face mask and the respirators. We have a huge variety available in the market, ranging from surgical masks to the filtering face piece respirator, the N95 mask, the N95 respirator and the FFP2 respirators, they come under filtering face piece respirator. Then we have reusable ones, elastomeric respirator and the powered air purifying respirator. So what are the difference between this respirators and the surgical mask? So the surgical mask is a disposable one, and it loosely fits onto the face. The surgical mask and the power air purifying respirators, they loosely fit onto the face. Whereas the filtering respirator and the elastomeric respirator, it gives a very tight fit. It seals, it gets seals with the face. So when you are using these two respirators, the filtering respirator and the elastomeric respirator, the face should be completely clean shaved. There should not be any facial hair which can act as a barrier between the, which will act against the seal. Then the surgical mask, it protects the other person as well as the environment from the substances, infected substances expelled by the wearer. But it doesn't protect the wearer from the airborne particles because it is loosely fitting. Whereas the filtering face piece respirator, it is intended to protect the wearer from the airborne particles. Also, the filtering face piece respirator, the elastomeric respirator, and the PAPR, it provides 95% filtration efficiency against particulates. Whereas the surgical mask, it doesn't provide any filtration efficiency. Then the surgical masks are considered to be fluid resistant. Whereas the other respirators, they don't clear the standards of FDA to be considered as fluid resistant. However, the surgical N95 mask is also considered as fluid resistance. Now, the N95 mask or any filtering face piece respirator, they have layers of crisscrossing non-woven fiber material. The air passing through it, it gets filtered by capturing the particles. Now, there are another variety available in the market, which is the respirator with a valve. Now, what is the function? What is the purpose of this valve? This valve, it helps in easy breathing. It reduces the breathing resistance during exhalation, because when exhalation occurs, the valves open and immediately shuts on inhalation. So this respirators with valve, it should not be used during surgical procedure, because the air expelled, it will contaminate the sterile surgical area. Also, this should not be worn by an infected person, because again, the infected particles may get expelled in the environment. Now, because there was shortage of these respirators and masks, the CDC recommended extended use and reuse of these respirators. Now, what is the extended use? It refers to continuous wear of the same respirator without removing between the patient, and it can be safely used for around 8 hours. However, to reduce the chances of soiling of this respirator, a face shield should be used. What do you mean by reuse of respirator? Reuse means after doffing of the respirator, you can again use it. But when to use it again? Now, it is known that coronavirus, it gets killed after 70, like it is viable only for 72 hours. So CDC recommends the use of respirators after 5 days, and it can be used for at least 5 times. But this respirators, it should be placed in breathable paper bag. So you should have set of 4 respirators, so that if I wear one today, I can wear it again on the 5th day. But when to discard these respirators? If you have done any aerosol generating procedure, or if it gets contaminated with blood, respiratory or nasal secretion, or any other body fluids from patient, or if you come in close contact with an infected person, or if you inadvertently touch the inner surface of the respirator, then in such situations, it should be discarded. So CDC recommended that the FFP respirators, they can be decontaminated. However, a perfect method for decontamination is still not found out. So according to CDC, decontamination can be done only to NIOSH approved respirators which do not have any exhalation valve. So the methods like UV, ultraviolet germicidal irradiation, vapors of hydrogen peroxide, and moist heat below 60 degrees, it can very well decontaminate the FFRs, but it should not be used for more than 5 cycles. Now, the decontamination process, it should not alter the physical appearance, or it should not cause any odor of the respirator. It should not affect the structural integrity, the filtration efficiency, and the fit and seal of the respirator. So you cannot just try any decontamination method, like you cannot just spray the respirators with ethanol spray, or you cannot autoclave the respirators, or you cannot do microwave sterilization. And as all these procedures, it can affect the fit, the integrity, the filtration efficiency of the respirator. So don't try any such experiments on the respirator. The best way, if you don't have equipments to use the vapor hydrogen peroxide, or if you don't have the UV light, then you just keep it in a breathable bag and use it after 5 days. The next PPE equipment, the next equipment is gloves. So gloves can be vinyl, latex, or nitrile. Nitrile are preferable because they have high tear strength and they do not cause allergies like the latex or the powdered gloves. Sterile gloves are used for surgical procedures, whereas for other routine dental procedures and all, sterile glove can be used. Two pair of gloves are preferable because while wearing, or there can be any small micro perforation of the gloves, so two pair of gloves will very well protect the wearer. Now, it is very important that the glove should be properly fitting. If it is loose fitting, then you will not get the good grip. And if it is very tight fitting, the prolonged use of tight fitting gloves, it causes pain in the muscles, and it compresses the nerves and tendons, and it may cause a reduction in the space of carpal tunnel in your wrist joint. So the wearer can have chances of developing carpal tunnel syndrome. Now, these gloves, it should never be reused or washed and used. It is only for single use purpose, and while discarding, you should tear it. Then comes the protective eye gear or face shield. Now, it is important to use medical goggles and not your routine goggles, which has space between the goggles and the face. This medical goggles, it forms a barrier, it forms a seal around your face, and it should have preferably anti-fogging characteristics. Even after having anti-fogging characteristics, these goggles, they become wet after prolonged use, because your skin is also breathing and your eyes are moist, so there are chances of these goggles getting wet. So I prefer using face shield, but this face shield, it should be properly extended beyond the ear. And another thing is, if you want to prevent fogging of the goggles, then you should ensure that your mask or your respirator, it is tightly sealed. There should not, it's tightly sealed onto the face. There should not be any escape of air. So to sum it up, I would say the correct PPE combination is selected based on the level of risk involved in the procedure. So for non-aerosol generating procedure, like it is a low risk procedure, you can use isolation gown which can be disposable or washable. You can use surgical face mask along with goggles or face shield and single pair of gloves. Then in medium risk procedures like your aerosol generating procedures, you should use fluid resistant coveralls which can be disposable or washable with GSM 90 to 60 to 90. And you should have FFP2 or a N95 respirator, and you should not use surgical masks for your aerosol generating procedures. A face shield should be used, and you should have double pair of gloves and shoe cover. Now, if you are treating a COVID positive patient, which is going to be a very rare scenario in a dental practice, so for such cases, you have to use a coverall suit which is disposable with above 90 GSM thickness. And you have to use a higher level respirator like your FFP3 or a PAPR. A protective eye shield as well, eyewear as well as face shield should be used with double pair of gloves, and the shoe cover should be covering above the ankle length. Now, PPE for patient. It is a better practice to give a PPE kit to even patient, because the patient will feel that yes, my doctor is concerned about my safety. And secondly, you can easily justify the higher charges the higher treatment charges that nowadays you have been charging the patient. So the PPE for patient involves the head cap, plastic hand gloves, thin plastic apron of 35 GSM, a face mask, and shoe cover. Now, before donning of PPE, the following preparation should be carried out. The nails should not be long or it may tear the gloves. It should be short and clean. Face should be clean shaved if you are using respirators, tight fit respirators. Females should tie their hair tightly, uh, then remove all the rings, bracelet, wristwatch, accessories, everything should be removed. Get into scrubs, gather PPE in a sterile room. Before donning the PPE, sip water and use washroom, because for next 3 to 4 hours in the entire session, you won't be able to drink water or use washroom. Perform hand hygiene with an alcohol-based hand sanitizer. So this is the sequence of donning and doffing recommended by CDC. Based on the combination of PPE that you are going to use, you can alter this method a bit. So now I will show you the demonstration of how to don and doff PPE. Hi, I will now be demonstrating the procedure of donning and doffing. So before we start with donning, we should keep everything ready. Donning procedure should be carried out in a sterile room. If you don't have a separate room to wear the PPE, you can also don the PPE in your operatory, which is sterile at the beginning of the session. Okay, so first you have to keep everything ready. The face shield, the coverall gown, N95 mask, gloves, everything should be ready. The next step is hand sanitization. So you have to take a good amount of hand sanitizer, rub your palm, then the dorsum of your hand, interlace the fingers, rub your thumb, then your fingertips, the knuckles should be sanitized, and lastly the wrist. So this procedure, hand sanitization, should be done for at least 20 to 30 seconds. After sanitizing the hands, we will first wear the gloves. So I prefer wearing 2 sets of gloves. So I use nitrile gloves. Then I will wear shoe cover. Shoe cover should go inside your coverall. So you can sit and wear the shoe cover. After wearing shoe cover, again sanitize your hand. Then I will wear the coverall gown. So you should make sure that you select the right size of gown, especially when a person is very tall or hefty. This right size is very important, otherwise it will cause stretch behind when you are sitting, and it will cause stretch in your neck. So a right size of gown should be selected so that you can move and sit comfortably. Now I'll unzip it. I will fold this sleeves inside, otherwise while wearing it may touch the floor. Then I put my one leg. You can again sit and wear this cover on. It is more comfortable. And then wear the sleeves. Now at this time I will not wear the hood. I will wear the hood later on. First I will wear the NIOSH approved N95 mask. So to wear this mask, you will hold it like a cup in your palm and then place it over your chin, and this nose pin, it should lie on the bridge of the nose. Then you first take the upper band and place it behind your head, and then this upper band, it should lie above your ear, and then the lower band, it will come below your ear around the neck. After wearing the face mask, you should adjust the nose pin with both your fingers so that it forms a proper seal over your face. Then you do a seal check. For doing seal check, you should breathe inside, inhale, and check it like this. You will feel some part of it is sucked inside if you get good seal, and when you exhale, your mask will blow out. If the seal is not proper, adjust the strap. Adjust the back strap and again do the seal check. Now after wearing the mask, you can wear the hood, and on top of it you can wear the face shield. This method is preferable because the strap of the face shield, it will not let the hood move. Otherwise, we dentists, we have a habit of moving our head, bending our head down. So if the face shield is placed inside and above it the hood is placed, the hood will keep moving, it will keep covering your eyes. So better is to wear first hood and on top of it wear the face shield. After wearing the hood, now this PPE I am not going to change in between patient. The entire one session I am going to wear the same PPE. So to prevent patient from cross contamination, I will be wearing this thin plastic apron of 35 GSM, which can be discarded after treating one patient. And now I wear the face shield, holding the strap, place it behind the head. And adjust the strap so that you get good fit. This cushion, it should lie over the forehead. And with this strap now, the hood will not move at all. Then lastly, again I will sanitize my hand and wear the outer glove before I start seeing the patient. again sanitize, and make sure that the cup of your PP should lie beneath the outer glove. Now after completing one patient, you can remove this outer plastic apron by tearing it off and rolling it in a ball and discarding it in a bin. You can discard it in a disposable bag. So then when you have to do next patient, what I do is I ask my assistant to spray this solution. This is hypochlorous acid solution, which is made by putting one tablet of Acrocept in 250 ml of water. My assistant will spray me this, then again I will wear the another plastic apron before starting the next patient. Now at the end of the day, you will doff your PPE. Doffing of PPE is a very critical procedure because your front surface is completely contaminated with what all stuff you don't know, aerosols and your blood and splatter. So this front surface you should not touch. Now for doffing before doffing PPE, if you see any visibly contaminated or soiled area, you can clean it with 0.5% hypochlorite. After that, first you will sanitize your hand. Sanitize your hand and remove the outer glove. To remove the outer glove, you will pinch the glove from outside. Pinch the glove from outside and take it away from your body. Hold it in your other hand. Now you should be careful that you should not contaminate your inner glove. So to remove the outer glove of other hand, you will slide your finger inside and pull it outside such that your first glove goes inside your second glove. Then you will discard it in a disposable bag. After that, again sanitize your hand. The next is to remove your shoe cover. Remove your shoe cover. Make it into a ball and throw it in the disposable bag. If you are using a disposable coverall gown, if you are using a washable gown, coverall gown, then you have to directly immerse it in a bucket filled with liquid soap and water. Now I will remove the face shield. To remove face shield, place your index finger on the back side behind of the strap and remove it like this. Now because you are going to use this face shield again, keep it on this green cloth so that directly you can wrap it and take it to the sterilization room, and there you can disinfect your face shield. Next is to remove now your hood and the coverall. To remove the hood, slide your finger inside the hood and slowly take it down. Then we remove the coverall. Unzip it and from inside, place your hand inside and try to remove it. Don't touch the outer surface. If need be, you can pull it from the back side. But be careful of touching your skin to the outer front surface of the coverall. Remove it inside out like this and keep folding it, rolling it downwards, inside out. Make it into a ball, and if you are using a disposable coverall, then make sure that you cut this coverall at some few places so that when it comes in the hand of rag pickers, they don't again sell this. Make a ball and place it in a disposable bag. After this, again sanitize your hand. Now we have to remove the mask. So again, to remove the mask, slide your finger behind at the back side of the strap, remove the upper strap, then remove the lower strap. Do not touch the outside as well as inside of the mask. Just hold it with the strap and place it in the brown bag. Write your name and date on this brown bag. Lastly, we remove the gloves. Put it in the disposable bag and again sanitize your hand. Hi, I will now be So I would like to conclude that safety starts with you first, and signing off. Thank you so much. Sorry, Kumaraswamy sir, for slightly extending the time.
Sameera,
thank you very much.
No, it was worth every single minute of extension. Believe me when I say this. We will have no regrets in granting those extra because the video was outstanding. And I'm not saying this because I have known you for years or you are there from E-Famdent, but truly this is what we need. Probably if this video was done sometime in April, I think it would have really touched it off. But fantastic.
Thank you so much, sir.
Excellent. Santosh, you want to comment on this before we let Sameera go?
The same thing. It was awesome. The video also was awesome. The theory was good. And as you rightly said, maybe this should have been done in April before people actually started doing stuff. Because there are a lot of things we realized that things may be going wrong.
Correct.
One thing I wanted to ask you, Sameera,
yes, sir.
is that the ankle-high shoe covers which you showed.
Yes,
could you just let us know which dealers can supply that?
So, sir, this M&M, Mafatlal, they are providing this, yes.
Okay. Good. Yeah. Thank you very much, Sameera. So proud of you.
Thank you so much, sir.
And you truly are the backbone of E-Famdent and Future Dent. We know that. And stay blessed. Thank you.
Thank you, sir. Thank you.